Okay, good afternoon, everyone. Welcome to today's community conversation, sponsored by MedStar Health. And our community conversation is titled The Intersection of COVID-19 and Cardiovascular Disease. I'm Wayne Carter. I'm the Communications Director for the American Heart Association of Greater Maryland, and I'm going to be your moderator here today. We'll get started in just a few seconds. We'll give folks another minute or two to join. Okay, I think we'll go ahead and get started. Again, good afternoon, everyone. Welcome to today's community conversation, the intersection of COVID-19 and cardiovascular disease, brought to you by our sponsor, MedStar Health. I'm Wayne Carter, the Communications Director for the American Heart Association for Greater Maryland. I'll be your moderator for our discussion today with our four doctors. At this time, I'd like to introduce everyone to our esteemed panelists who are joining us today from MedStar Health. First, we have Dr. Chandi Banerjee, who is the Chief of Infectious Diseases at MedStar Good Samaritan Hospital and was named a top doctor for infectious disease in 2019 and 2020 by Baltimore Magazine. Dr. Banerjee, thank you for joining us here today.
Thank you.
And then next, we have Dr. Samir Najjar. Dr. Najjar is the Regional Chief of Cardiology for the Baltimore region for MedStar Health, with oversight of the cardiology departments at MedStar Union Memorial Hospital, Good Samaritan Hospital, Franklin Square Medical Center, and Harbor Hospital. In addition, he oversees the MedStar Medical Group's ambulatory cardiology practices. And thank you for being here as well, Dr. Najjar.
Thank you for having me and for hosting this session.
Then next we have Dr. Raghuveer Vallabhaneni, Vallabhaneni, and is a fellowship trained vascular surgeon who is board certified in vascular surgery and is the director of vascular surgery for the Baltimore region of MedStar Health. Dr. Vallabhaneni also has specific expertise in treating complex aortic disease and has developed a national reputation in his field. Thank you for joining us, Doctor.
Thank you, Wayne, for having us.
Absolutely. And finally, we have Dr. Calvin Williams, who is part of MedStar's inpatient internal medicine faculty. In addition, he provides inpatient infectious disease consults, and Dr. Williams is also involved in antibiotic utilization as well as infection control at MedStar Union Memorial Hospital. And he was also named a top doctor for infectious disease by Baltimore Magazine in 2019. Thank you for joining us, Dr. Williams.
Thanks for having me.
All right. So at this time, we'll jump right into some of our questions in this important conversation here today about COVID-19 and cardiovascular health and disease. So we will start with Dr. Banerjee. And our first question is quite simply, I'm concerned about getting COVID, especially with the new variants. What are the best prevention methods for COVID-19?
Well, I think one should be concerned about getting COVID-19, especially with the variants that we have now, particularly the Delta variant, in terms of it's more infectious, has a higher viral load. In terms of the best prevention method, I think number one is getting the vaccine. I think the vaccine is the best prevention that we have in getting active COVID-19 infections. And the next best step will be wearing a mask, and wearing a mask in indoor situations where you're going to be close to other people. And then the other methods would be washing hands and keeping away from crowds, things like bars or gatherings with large numbers of people who may not be vaccinated. Calvin, do you want to add to that?
No, the only thing I'd add would be that I know that the concern increases as we hear more and more about the variants, but the good thing so far is that the vaccines we have available to us are effective at preventing severe disease, hospitalization, and death against all the variants that we've experienced thus far, and all the non-pharmacologic methods that you listed, being like namely mask wearing and keeping distance, they work regardless of what the variant happens to be.
All right, thank you, doctors. This next question is for Dr. Vallabhaneni. I've heard that COVID-19 can affect the heart. Can you talk about what ways and what are the cardiovascular risks of getting COVID-19?
Well, thank you, Wayne. So COVID-19 may affect all cardiovascular tissues, including the lining of the heart and all the blood vessels throughout the body, called the endothelial cells. This with inflammation could cause clotting of different blood vessels by both the cascade of the inflammatory response going through your body, as well as the virus replicating in the tissues of the cardiovascular area. This could weaken both the blood vessels as well as the heart. Dr. Najjar, would you like to comment specifically on the effects on the heart?
Yes, I think this is something that we have been monitoring very closely throughout the pandemic. From early on, when this whole thing started, it was very clear that there was a cardiovascular effect from COVID. And even though we feel like we've been in this pandemic for a long time, in fact, we're only talking about 1.5 to 2 years since this started. So this is something that we're still in the process of learning more about. What we've learned so far is, as Raghu just mentioned, that there are direct effects in terms of the inflammation that's happening inside the blood vessels, but there's also the inflammation that's happening systemically in the human body that is actually directly affecting the heart. And one of the things that we've seen is there is actually a substance, a compound that we measure called troponin, that when there's an injury to a heart or some heart cells die, that troponin gets released and the levels go up in the body. And what we found is that patients on whom that substance that we measure, the levels go up, telling us that there is an injury that's happening to the heart, those patients are at increased risk of having complications from the COVID, and they're at higher risk of dying. So there's definitively a subset of patients who, when they get COVID, the heart and the cardiovascular system gets affected. And in those on whom they do get affected in terms of their heart and their blood vessels, they are at higher risk of having bad outcomes. There's a smaller subset of people in whom the COVID might affect the heart directly, meaning it's the COVID that's having an effect, not the inflammation that's due to COVID that's having that effect. But that's the minority of the cardiovascular cases. In most cases, it's more that inflammatory response and the inflammation that's happening in the blood vessels and that's happening in the lungs that's also causing the injury to the heart.
Thank you, Doctor. All right, our next question is for Dr. Williams. They write that I had COVID months ago, but I still don't feel like I've fully recovered. Can you explain long COVID?
So so this is a great question. I'll just start by saying that we define long COVID as persistent symptoms that last for more than 4 weeks following an infection. This could be even an infection that was asymptomatic or only mildly symptomatic. Anywhere from 10 to 30% of people who had COVID can have these persistent symptoms, and they can include things like having persistent cough, shortness of breath, palpitations, chest pressure or pain. Can also be fatigue and sometimes what they call brain fog, where you have difficulty remembering things, concentration issues, etc. It's poorly understood exactly what causes these symptoms and why they occur in some and not others. One good thing is, I think finally about a month or two ago, the NIH has started to do large-scale clinical trials to try to identify what causes the long COVID and then also how to treat it. So that's what I would start by saying about long COVID. I'm not sure if Dr. Banerjee has something she wants to add.
The only couple of things I would add is that there appears to be a somewhat lower prevalence in children versus older adults. So, that's a good thing. And as Dr. Williams mentioned, unfortunately, these symptoms can last many months after the initial illness, and the initial illness does not have to be severe. It can be quite mild. So even mild COVID can trigger, a lot of these symptoms. And a lot of places are studying these, and a lot of patients are getting into studies to look at this further. So hopefully we'll get more information on how to treat this better.
Just a quick follow-up question for Dr. Banerjee and Dr. Williams. Is it possible that you can have different symptoms like through long COVID as opposed to the ones you initially had when you contracted it?
So yeah, so you like we both said, your initial COVID infection may have no symptoms at all. So you can have different symptoms from your long COVID than you did during the actual COVID infection. And I guess the last thing I'll say is that there is some preliminary information, some preliminary data that actually those who have had long COVID, who've then gotten vaccinated, about 30% of them will have decreased in their symptoms of their long COVID symptoms following being fully vaccinated. So that's one thing to consider if you do have these long COVID symptoms and you haven't been vaccinated. It may actually help with your long COVID symptoms.
Thank you, Dr. Williams. All right, our next question is for Dr. Najjar, and it is someone wrote in, I already have cardiovascular disease. Can getting COVID-19 increase the cardiovascular effects?
Yeah, that's a good question, and it's multi-layered. So I want to address a couple of the topics in there. Number one is something we already alluded to, which is that the COVID can have an impact on the heart and on the cardiovascular system. But in addition, what we've also found out is that patients who already have pre-existing cardiac condition, number one, they're at more risk of getting hospitalized and having complications when they get COVID. So COVID itself can affect the heart, but if you already have a heart condition, that puts you at an increased risk of having the types of complication that you can get from COVID. So if you just looked at hospitalized patients, for example, there's a higher prevalence. The percentage of patients who are hospitalized because they're having complications or issues with the COVID have a high percentage of patients who have pre-existing diseases, and those diseases are the cardiovascular diseases, the heart diseases, but also additional ones that we can't ignore, including high blood pressure and diabetes. And to round it out, is also, we all know that it also impacts older individuals and individuals who are immunocompromised. So just to repeat it, so those 5 categories of patients: older individuals whose immune system is depressed, oftentimes because we're giving them medications or because they have some diseases, and those who have cardiovascular risk factors, so high blood pressure, diabetes, or pre-existing heart disease. These people are at highest risk of having sort of more complications and bad outcomes, including death, when they get infected with COVID. Dr. Vallabhaneni, any additional things to add?
Yes, I would definitely agree with everything that you said. If someone has a previous cardiovascular history, they're definitely more at risk of having complications related to a COVID infection, increasing hospitalizations and death. And again, to reiterate, one of the best ways to prevent this, if you do have cardiovascular risk factors, is to try to get vaccinated to help mitigate some of these complications.
And just to sort of complete the discussion in terms of the direct effects on the heart, we talked earlier about how the inflammation can have an impact. In rarer situations, there could be a direct effect in the sense that a person could have a heart attack, the classical heart attack that we think about, where there's a rupture of the plaque and the person has a myocardial infarction. That has been seen. We're going to talk in a little bit about the direct inflammation of the heart, but those are not the majority of the cases. The majority of the cases is this inflammation that's impacting the heart and impacting those patients who already have either heart disease or risk factors for heart disease and cardiovascular disease.
Okay, very good. And that does kind of dovetail into my next question for Dr. Vallabhaneni. Someone wrote in that their mother had a heart attack a few years ago and she's doing well now, but they're worried about what might happen if she does contract COVID. So what are the outcomes to someone without any known compared to someone without any known cardiovascular history, and what, if anything, can be done to improve the outcomes?
Thanks, man. That's a great question. So as we mentioned, someone who has a pre-existing cardiovascular condition, such as having myocardial infarction or heart attack in the past, is a higher risk of having a complication of the COVID vaccination, including that could affect both their heart and other organs in their body. To help prevent this outcome and try to decrease the risk, a lot of the safety issues that Dr. Banerjee and Dr. Williams mentioned previously, such as masking, social distancing in crowds, but also primarily getting vaccinated, could help stop or prevent patients from getting hospitalized or even dying if they do contract the COVID infection.
Okay, thank you. Our next couple of questions are specifically related to the vaccine. And Dr. Banerjee, we will start with you for this one. Person writes that my employer is requiring that I get the COVID-19 vaccine, but I'm concerned about the possible side effects. What, if any, are the cardiovascular risks of getting the COVID-19 vaccine, and are the risks the same with all three brands of the vaccine?
I'll start with, I think the main thing that we've heard about in terms of cardiovascular risk is potential for myocarditis, which again is inflammation of the heart muscle. And if you look at the data, it's been studied extensively among the studies in the vaccines, but also we have good data out of Israel, where there's a highly vaccinated population, and they've been studying it for a number of months. And out of 1.7 million patients who received the Pfizer vaccine, the myocarditis risk was calculated to be like 3.24, or out of 2.5 million vaccinated people in Israel, there were 54 cases of myocarditis total, which gives it a rate of about 2.1 per 100,000 individuals. It was slightly higher in younger population, in the 16 to 29-year-old, where it was like 10 per 100,000. But if you compare that to the possibilities of getting myocarditis, if you get the infection, the risks are much higher. If you happen to get COVID-19 infection, the risks are at least 18 to 20 per 100,000. And you can get other complications as well, including pericarditis, heart arrhythmias, and other issues. So in terms of the cardiovascular risk of getting the COVID-19 vaccine, I think there is a risk, but it's a very small risk at this point, as we know. And I think that's sort of the way it is at this point anyway. Whether there's risk with all three vaccines, Calvin, would you like to address that?
Sure. So for the primary risk, at least the one that's the most talked about or the most concerned on, like Dr. Banerjee said, is the myocarditis and pericarditis. Those seem to be most commonly associated with the mRNA vaccines, which would be Moderna and Pfizer vaccines. The Johnson & Johnson vaccine doesn't seem to have the same impact on myocarditis or pericarditis. And then also, like Dr. Banerjee said, the risk in general is really low and seems to be highest in people who are in the 16 to say 30-year-old range, primarily in males. But those generally aren't people who actually have cardiovascular disease. You tend to have cardiovascular disease when you're over the age of 40. The Johnson & Johnson vaccine is still used in the United States. Its primary, most serious risk, I'll say, is actually clotting disorders. and that's primarily in young women, women under the age of 50. It's pretty rare, but there is a risk associated with that. And that's all I would add at this time.
If I could also add to that, because I think that's a very important question because it keeps coming up. It is in the news media. We read about it quite a bit. There's this thing called myocarditis, which for the layperson is a scary thing because they know that it's heart and it's inflammation in the heart. And I would ask myself, why would I put myself through that risk for going through the vaccine? And I think there are two very important points that Dr. Banerjee and Williams alluded to that I want to echo and emphasize. The first one is if you just look at the raw numbers, at the plain numbers. So if you take the vaccine, your risk of having this inflammation of the heart is about 2.1 per 100,000. But if you don't take the vaccine, the risk of having the myocarditis is about 10 times higher. It's about, depending on the studies, anywhere from 10 per 100,000 up to 20 per 100,000 in the latest studies that we just saw. So we shouldn't just look at what is the risk if we take the vaccine. We also have to figure out what is the risk if we don't take the vaccine and we do get COVID. And perhaps more importantly, another important thing is instead of looking at myocarditis as black and white, yes, no, people have also now been looking at what happens with this myocarditis. So what we're finding is that the patients who get the myocarditis after the vaccine, the vast majority of them have a very benign course. There's no complication. They usually present with chest pain about usually a 3 or so days after they have the second vaccination. That's the most typical presentation. The symptoms last a couple of days, then they go away, and the patients do not have any complications from this myocarditis. This is different than what happens in patients who get myocarditis from COVID. Those who are getting myocarditis from COVID are actually at higher risk of having complications of the myocarditis itself. So in that case, the inflammation of the heart is leading to its own problems. Some people may end up with a weakening of the heart and heart failure. Some have had arrhythmias, and some have actually ended up getting a progression of this myocarditis into what's called fulminant myocarditis, which means a very severe form of myocarditis that could in and by itself be lethal. So when we think about what is published in the I guess lay press or in the media that there is a myocarditis associated with the vaccine, that is very true. But to put it in its correct context, we also have to bear in mind that if you don't get vaccinated and you get COVID, you are at number one higher risk of getting myocarditis, and more importantly, that myocarditis, the clinical course of that is much more significant or severe than the benign course that you get if you have the myocarditis associated with the vaccine.
Okay, thank you. Our next question was actually asking about myocarditis. I think our doctors have explained that pretty well, but they also asked about pericarditis and that as a potential side effect. So perhaps Dr. Vallabhaneni and Dr. Najjar can help explain what pericarditis is and how that relates to the COVID vaccine.
So pericarditis is the inflammation of the lining of the heart around the sac that's containing the patient's heart, which could happen for various reasons, and which is separate than myocarditis, which is the actual inflammation of the heart muscle itself. And most of what has been described has been the myocarditis associated with the COVID vaccine. But as Dr. Najjar was mentioning, it is shown to be far less than patients who actually contract COVID, their incidence of myocarditis. Dr. Najjar?
Yeah, I know. I would echo what you just mentioned, which is that with the vaccine, the reports have mostly been myocarditis, whereas the pericarditis, again, the inflammation of that sac in which the heart sits, is something that we see that can be seen in patients who have the COVID infection itself. And it tends oftentimes to be associated, but not always, with the myocarditis. In other words, it's an inflammation that could affect both the heart and that pericardial sac that in which the heart sits. And it could also end up being a complication of the myocarditis. So the pericarditis is something that we think about it more in the context of getting the COVID infection itself as opposed to the COVID vaccine.
Okay, very good. So next question, also for Dr. Vallabhaneni. They write, I was recently diagnosed with PAD. I've heard that blood clots are a potential side effect to the vaccine. Can you explain what exactly happens when you get a blood clot and what complications this could cause?
That's a great question. So PAD is short for peripheral arterial disease, which is the development of plaque throughout the body, throughout all the arteries in the body. It commonly affects the legs as well as the arteries to your neck. One of the complications of both COVID as well, first I'll start off with COVID, is the incidence of clotting is increased. And as I mentioned previously, the endothelial cells, which are the cells that line all the blood vessels in our body, from anywhere from our the blood vessels into our lungs, into our legs, into our main blood vessels, the aorta, could become very inflamed from viral replication within those cells. That could cause inflammatory state, which when someone does have a high inflammatory state in their body, that in and of itself could cause them to have more blood clots form in their body. Also, the damage, the direct damage to the blood vessel could also cause clotting in the body. Over the past year and a half, I have seen and operated on several patients with COVID-19 who have presented, even though they're relatively young and healthy, anywhere from their 30s and 40s, some with previous cardiovascular disease, but have clotted off their aortas, clotted off their legs. They're patients who've had strokes secondary to COVID-19 infection. So there is a significant concern for blood clots when you have a COVID-19 infection. Now, as far as the vaccines are concerned, as Dr. Williams mentioned, the Johnson & Johnson vaccine has been associated with some clotting disorders. The one in particular is in middle-aged women called thrombocytopenic thrombotic syndrome. That being said, that incidence was about 15 people out of 8 million doses. So it is a very, very rare occurrence. The occurrence of complication of clotting from the COVID-19 infection is much, much greater than that. And is and we use blood thinners actually as one of our therapies in treating patients who are hospitalized with severe COVID-19 infections to prevent some of these clotting problems that do occur with the infection. So although blood clots from the vaccine could be a concern, if you do have a history of PAD or peripheral arterial disease, I would highly recommend trying to take care of yourself, get vaccinated, wear a mask in crowded locations to try to prevent the more concerning clotting complications from actually obtaining a COVID infection.
Very good. Thank you, doctor. Our next question really could be, I think, for any of our panelists. My family has a history of cardiovascular disease, and I think we've talked a little bit about that already, and whether or not it's safe to get the vaccine. but they want to know your thoughts on getting the booster shot. So I don't know if maybe Dr. Banerjee wants to address that one first.
Sure. Well, that's something that's come up recently in the last few months. We have noticed that there is perhaps decreasing antibody levels in some populations who did receive, up to this point, the Pfizer vaccine. We don't know the data quite yet on the Moderna or the J&J. And the FDA and the CDC came out with guidelines on such. And it appears that patients, particularly patients who are over the age of 65, who are immunosuppressed, have severe underlying medical conditions, would benefit from a booster vaccine. And the booster is basically a third vaccine. It's not unusual when you get vaccines that you need 2 or 3 shots. Like we get a flu vaccine every year, or with hepatitis B, if you get waning immunity, you get another shot. So it's not infrequent that when you have vaccines against various viruses that you do need another vaccine. Now, again, there's a lot of data out of Israel where they did see an increased, started seeing an increased incidence of illness in patients who had gotten the 2 Pfizer vaccines. And they decided to go ahead and give the 3rd shot or the booster. And it looks like the patients who did get the booster, again, had better response and had decreased hospitalizations and severe illness. So that's what's recommended at this point. And I think if you had the Pfizer vaccine more than 6 months ago and you do fit the category, then I think it definitely makes sense to get the booster.
Very good. I think I saw Dr. Williams look like he wanted to jump on right before I asked you. So I don't know if he has anything else to add on the booster.
No, I guess just the first part of your question was about family history of cardiovascular disease. That should have no bearing on, that shouldn't prevent a person from seeking to get vaccinated. If anything, it would probably be to their benefit to be vaccinated for all the reasons that were identified earlier by Dr. Najjar and Dr. Vallabhaneni, because you have increased risk of having negative outcomes if you personally have cardiovascular disease.
Makes sense. Anyone else?
Yes, I would. I think implicit in what we're saying is that again, this pandemic, we've only been living it for about 1.5 years, maybe a little slightly longer, and we're learning. And this issue, the booster shots, recently just came out, right? Because the vaccines only became available less than 1 year ago. And so I think that anything that we say today is going to change over the next weeks and months as we get more information, as we get longer follow-up. So the take-home message for me on this one is stay tuned, because this is actually being studied and evaluated. And we just learned, as Dr. Banerjee pointed out, that there's certain people in whom we know are now benefiting from the booster vaccine. They were already recommended to get it. I suspect that with the passage of time, there may be more subgroups who we find out that they may also benefit. So, but I think this is an evolving story, and we're all learning about this together. So stay tuned. And in a few weeks or a few months, we'll have more to add.
Very good.
Yeah, and I
Anyone
think
else?
that there, has been a lot of vaccine hesitancy for various reasons, and some of it being someone's personal or family health conditions. But as we all previously mentioned, you're at risk of having a severe complication if you get the COVID vaccine than you are of having a vaccine reaction or problem from obtaining the vaccine. So it is important to try to protect yourself the best way as possible, would be to get the vaccine as opposed to trying to, especially if you have pre-existing condition that puts you at higher risk of complications.
Okay, thank you, doctor. Our next question is for Dr. Williams. They write, I keep hearing about fully vaccinated people still getting COVID. And I'm confused. What's the benefit of the vaccine if I get it and I can still get COVID?
So yeah, this is a pretty common question. The best answer is simply this, that vaccines are they're not designed to eliminate the possibility of you getting infected. What vaccines are intended to do is to change the consequences once you become infected. And more specifically, you can think of there being 4 possible outcomes when you become infected. One is you have mild symptoms like a common cold and no symptoms at all. You can have flu-like illness, which is, we call that moderate symptoms. You can have severe symptoms, which typically leads you to be hospitalized or seek medical care. And then unfortunately, people die. So those are the 4 outcomes. The goal of the vaccine is to reduce your risk of severe disease, hospitalization, of death. And they've been shown consistently to do so. So that's the reason why it's beneficial to get vaccinated for everyone, and especially for those who have pre-existing medical conditions, because their risk of the worst outcomes is so much higher than those who don't have severe medical conditions. And then the other thing that I would just add to that is that we're still learning what impact the vaccines do have on your ability once you become infected to transmit to someone else, and what impact they do have on keeping you from being infected at all. They do have some ability to prevent infection at all, but that's not the goal of the vaccine. And that ability to prevent infection at all, that's what wanes over time. So when you hear people say waning immunity, what they're referring to is the ability to have infection of any sort. That decreases over time as your antibodies go down. But fortunately, these vaccines, the mRNA vaccines and the Johnson & Johnson vaccines, they elicit what we call memory responses, T-cell and B-cell responses. They play a bigger role in preventing the severe outcomes, being severe disease and death, relative to just the antibody levels. So that would be my answer to that question.
That makes sense. Thank you, doctor. Anyone else have anything to add to that?
Yes, I'd like to add something in that what I tell my patients is that, particularly my immunosuppressed patients, is that get the vaccine because it will protect you, but act as if you're unvaccinated. So still wear your mask, still keep your distance, and still keep safe. It's not a free pass. It's not 100%. It will protect you as much as it can, but you still have to be vigilant. And so I think it all works together in that fashion.
That makes sense. Thank you, doctor. Okay. Our next question actually came in from someone in the chat. They write, my mother passed from COVID-19 in 2020, and she was a former stroke patient. Do you have any dietary recommendations to suggest that would be best for anyone who has a family history of hypertension? Thank you. So I'm not sure who might want to tackle that one about dietary suggestions for people with a family history of hypertension.
Sorry. So I think that the recommendations that I would provide will be the recommendations that are independent of COVID. I think that there are dietary recommendations for prevention of cardiovascular disease that we all should follow, whether we are in a pandemic or whether we're not in the pandemic. And this has to do with, and I actually broaden it a little bit more, and I would say I'll call them sort of lifestyle decisions, of which diet is one of them, but also physical activity and exercise is another component to it. Weight management is a third component to it, which actually dovetails with both nutrition and exercise. In terms of nutrition itself, we advocate that people eat a healthy diet, and people on whom there is concern about either hypertension and or stroke, specifically salt is an issue, and people need to limit how much salt they put in their diet. So a very easy recommendation that I provide everybody is do not put a salt shaker on your table. Completely cutting out salt from the diet is not realistic, because then the food is tasteless and nobody will follow that. So we don't want to give any draconian instructions, because then people are not going to follow them long term. We want to give reasonable instructions. So a little bit of salt in the diet while you're cooking is actually a reasonable thing to do. But then what you don't want to do is then when it's time to eat it, don't sort of just saturate it with additional salt. Just stop at that. I think that's how I would recommend that you limit the salt. The other thing is, what kind of foods are you eating? So for example, the foods that come in, what do you call them? The containers, the
Prepackaged.
packaged foods and soups that you get in supermarkets, all these are very high in salt content. So you want to avoid these, and you want to instead focus on fresh fruits, fresh vegetables, salads, things of that nature. And so I think the type of food that you eat, the quality of the food that you eat, and the quantity of the food that you eat all matters. And it's a thing that these lifestyle modifications are things that you want to be able to adopt for a long time. So again, do reasonable interventions that are going to be long lasting, and not try to take some draconian intervention that you can only, tolerate for about a week or two, and then you're like, I can't do this anymore, and then you go back to your previous habits. Those are from the answer to that question directly in terms of what are the dietary modifications. But I want to take this one step further, and relating it back to COVID. One of the things that we have not yet covered, we talked about the effects of COVID on cardiovascular disease. And this is something that hopefully we're over it now, but it was certainly more prominent a year ago when we first entered the pandemic, and when the cases were rising, is that there was a price that was paid that was indirectly related to COVID, meaning there are a lot of patients with cardiovascular diseases, either existing or new, who did not seek medical attention, because certainly at the time there was that notion that COVID was concentrated in medical centers, and I don't want to go there because I might get exposed or I might get infected. And now we have convincing data that patients did have cardiovascular problems. There were heart attacks. There were other things that came up, which should have been or could have been treated and had better outcomes had people presented themselves and went to their healthcare appointments and seen their healthcare providers. And so that is a message that I would like to make sure that we also propagate, which is it's important to pay attention to COVID and to the pandemic, but do not ignore regular cardiovascular diseases, because they were there, they're still there. They have not been, they're not ceasing to exist just because we're in the middle of a pandemic. And we don't want people to pay a price in terms of not seeking healthcare when they should, for cardiovascular diseases or any other disease for that problem in the context of that pandemic.
Could I just add one other thing real quick?
Sure.
So sometimes this comes up also related to dietary changes a person can make to avoid COVID. There are these pieces that come up on the internet where they say you could take this vitamin or you can take this root or this herb, and somehow this is going to prevent you from getting COVID or treat you from if you develop COVID. And there simply is no evidence supporting that. So if someone is thinking they can take certain vitamins, et cetera, that will prevent them from getting COVID or prevent the worst outcomes, unfortunately, that simply isn't true. So all the mitigation efforts that we talked about in the beginning, mask wearing, getting vaccinated, social distancing, those things have evidence supporting their efficacy. But things like vitamin C, vitamin D, they haven't panned out in large clinical trials in terms of actually having efficacy, preventing COVID or treating people who have COVID.
Thank you, Doctor. Dr. Najjar started to talk a little bit about the dangers of delaying care. And Dr. Vallabhaneni, I was wondering if you might be able to expand on that just a little bit, of what the what the elevated risks are of waiting to delay care, whether it's cardiovascular or anything else.
Sure. I've had definitely personal experience seeing patients who have told me during the pandemic, especially at the beginning, when people were afraid to come in to get their carotid surgery or to get their leg revascularized because they were concerned about getting COVID in the office setting or in the hospital. But there have been patients who have had strokes from delaying care and have had progression of their vascular disease in their legs, who may have been able to be prevented if they came to the office. And personally, I think that, telehealth visits, although they are a touch point for seeing doctors, it's not the same thing as being in a doctor's office, having them examine you, seeing things that they wouldn't have noticed otherwise. I think that, as, MedStar and other health systems, have promoted vaccination for all their employees. And I think that it is relatively safe to come into, the office to get examined. And especially if you notice something that's going wrong in your body, a lot of people were, especially at the beginning of the pandemic, dying of heart attacks at home, having strokes and not presenting. And things might have been able to have been done to help prevent severe comorbidities that were not done at the time. So I would say that please do not delay coming to your doctor, especially if you have a symptom, because having cardiovascular disease or a history of cardiovascular disease is one thing, but actually having a symptom of decreased blood flow, either to your heart, a sign of a mini stroke or a stroke, or worsening pain in your legs because you're not having enough blood flow, could be life-threatening or limb-threatening for sure.
And Wade, if I can share an anecdote, sort of one of the extreme examples I was involved in, and this was, again, in the early days of the pandemic when there was a lot of unknown about COVID, but we knew enough that, the death rate of COVID was about 3, 4, 5% of those who were infected. I remember vividly being on the phone with one of my patients who, when talking with them, I realized that what they had was something called cardiogenic shock. And there, your mortality is, we're talking about 70 or 80% chance of dying. And it took me 3 days to convince the person that coming to the hospital, because they were afraid of coming to the hospital getting infected with COVID, yet when you put them side by side, one has a 3, 4, 5% risk of mortality, the other one was over 70% of mortality. And so now that's an extreme case, but now we have epidemiologic data where when people have looked at the previous year and they looked at the deaths that happened over across the country, and so they calculated, we expect, let's say, a certain percentage of patients to die every year. That's what happens. And then they added to it the number of people who we know died because of COVID. Those are numbers that we knew. Yet there was an excess number of deaths that have happened, which cannot be accounted for by COVID, meaning that excess deaths was related to the fact that there are likely a lot of people who had conditions that in years before that they would have presented themselves, we would have treated them, but they did not, most likely, which is why they probably passed away without us being able to address them. So that excess death that is attributable to the COVID pandemic, but not to the COVID infection, is real and has been demonstrated in epidemiologic data across the country.
Makes sense. All right, we're getting close to 1 o'clock here, so I want to kind of be respectful of everyone's time, but I do have one more question that came into the chat that I wanted to ask, because I think it's a good one. This person writes that they have a relative who is pregnant and is due later this year, but she's unvaccinated and they're stressing out about it. So can one of you talk a little bit about pregnancy and the vaccines?
Sure, I'll jump in first and then Dr. Williams can jump in. I mean, COVID vaccine and pregnancy is a big issue right now in our country. Only about 31% of pregnant women are vaccinated. It's highest in the Asian population, about 45% are vaccinated. In Hispanics, about 25%. In the African American population, maybe about 15%. And out of 125,000 patients with COVID who've been followed, about 22%, 22,000 were hospitalized. And there was a significant amount of death, and then also twofold increase. And if a pregnant woman does get COVID, there's a much higher risk of her being hospitalized and unfortunately having a bad outcome, and the baby as well. So I think it is highly recommended that patients who are pregnant, particularly if they have potential risk factors such as diabetes, hypertension, obesity, that they definitely get the vaccine. And the vaccine has not been shown to have any increased poor outcomes for the baby or for the mother compared to, with the vaccine, there's not been a higher increase of side effects in the pregnant population.
Dr. Williams, do you want to add anything to that?
No, I'd completely agree with everything that Dr. Banerjee said. The other thing I would add is that right now, young children, infants, there's no vaccine approved for them, but a vaccinated mother can transmit her antibodies that she gets from the vaccine through the placenta to her child and offer them some protection that way. So that's another reason for a pregnant mother to choose to be vaccinated rather than not be vaccinated.
Very good. All right, before we wrap up here today, I just wanted to give each of our four doctors, first of all, thank you for joining us here today and this important conversation. We do appreciate your time. Wanted to give each of you an opportunity to sort of talk about what's one thing that you hope any of the viewers of this webinar can sort of walk away with that sticks in their head. And we'll start with Dr. Vallabhaneni.
Thanks, Wayne. The couple things I'd like to make sure that everyone remembers is that no matter what the side effects of the vaccine are, getting COVID is much worse and much deadlier to you and more likely to cause harm or permanent harm. So please get vaccinated if you have not. The other thing is please do not delay care, especially if you're having any symptoms of cardiovascular disease, such as increasing pain in your legs, signs or symptoms of a stroke or mini stroke, or chest pain, or signs or symptoms of a heart attack. Those are two very important points. Please do not delay care and please get vaccinated.
Okay, thank you, Doctor. Dr. Najjar.
I want to echo what Dr. Vallabhaneni just said, which is that if you're having symptoms, do not delay. And do understand that if you do have cardiovascular disease or at risk of having cardiovascular disease or have some risk factors like high blood pressure or diabetes, you are definitively at increased risk of having complications if you do have COVID. I also want to echo a second point, which is that we have vaccines that work. And so particularly patients for cardiovascular diseases, but really all patients should seriously take them because we know that oftentimes there are things that appear in the media that may look scary to us, but before we take them at face value, we should compare what are these risks or side effects compared to what will be the risk or side effects if I don't take the vaccine and I get COVID instead. And I think we went in detail into the issue of myocarditis, but it applies to many of the other things that are being mentioned. So please consider seriously taking the vaccine.
Thank you, Dr. Najjar. Dr. Williams.
No, I would echo everything that's been said. I would also add that, to just reiterate, I say, don't wait. The longer you wait, the worse your underlying medical conditions can be. And it becomes harder to try to treat, to be quite honest with you. It can actually lead you to be eliminated from certain therapies that could actually be limb-saving or life-saving. So that would be one thing I would say. The other thing I would say is that those mitigation strategies, the wearing the mask, the social distancing, et cetera, they work at the grocery store, they work at your job, and they work in a doctor's office. So you can continue to do those even in the waiting room at your doctor's office. So if you're concerned because of maybe catching COVID, and that's why you don't want to see a doctor, you can use those same risk reducing strategies that you would use anywhere else. And then the last thing I would just reiterate is that of all the possible therapies, et cetera, that we have, nothing's better than prevention, right? Nothing's better than prevention. And what we have to prevent COVID is vaccines that are safe and effective. They do reduce your risk of having infection at all, and they are great at reducing your risk of having negative outcomes if you do become infected. So I would say, rather than getting advice from Facebook or wherever, or the social media, talk to your doctors if you have questions, and get medical advice about the questions you have surrounding the vaccines, and then make an informed decision.
All right, thank you, doctor. And finally, Dr. Banerjee.
Yes, I would of course agree with everything that's been said so far. Again, please, please, please get your vaccine. It's the best thing you can do for yourself. And as I tell my patients, as I've said before, get the vaccine, but act as if you're unvaccinated. So still keep distancing, wearing your mask, and being safe. And then lastly, if you do get COVID-19, please contact your physician early. We do have monoclonal antibodies that really do help prevent patients from getting more severely ill. But there's a time limit in terms of after your infection when you can get the monoclonals. So, and then lastly, I would also say is please come to your doctor's office for evaluations. There's nothing like a one-on-one visit with your physician. And personally, I feel much safer in the hospital and in my doctor's office than I do in a restaurant. So I think you just have to take all that under consideration.
Okay, very good. All right, well, once again, I want to thank our doctors from MedStar Health for taking the time out of their busy schedule to join us for this important conversation here today about COVID-19 and cardiovascular health and disease. I also want to take a minute to remind everyone that the Greater Maryland Heart Walk is just 3 days away at the Camden Yards Sports Complex in Baltimore. If you want more information, you can visit greatermarylandheartwalk.org for more information there and to register or to donate. So once again, thank you to our doctors, and we hope to see you at the Heart Walk this Saturday, October the 16th at Camden Yards. Have a good one, everyone.
Thank you.
Thank you.
Thank you.